All right, good evening, everybody. My name is Dr. Mark Suter. I'm a periodontist in Bloomington, Indiana, and I'm trying to do something for the first time. I have to admit, I'm stepping out of my box. I'm a little bit nervous about this idea, but I really am going to try it. And really what I wanted to do was I wanted to create a forum in which the average person could ask really basic dental questions or just oral health questions that you could feel I can give you honest answers. And if I don't know the answer, I can certainly look it up and find the answer for you. So what I wanted to do as a periodontist, and first of all, what a periodontist is, a lot of times people ask me, they'll ask me what I do, and I'll say, I'm a periodontist, and people inevitably go, oh yeah, I've had braces before, and I kind of shake my head and say, no, that's not really what a periodontist is. That's an orthodontist. And then they'll say, yeah, I've had a root canal, and I'm like, no, I'm not a root canal guy. That's an endodontist. So anyway, a periodontist is a specialist who specializes in helping you really keep your mouth healthy, prevent you from having gum disease, and hopefully keep your teeth the rest of your life. So I pretty much spent the last 25 years of my career really helping people live a healthier life by improving the health of their mouths. And for the unfortunate people who have lost their teeth, we do a great job of being able to do dental implants and be able to help people replace their teeth. But my main job is really trying to help people improve the health of their mouths and really hopefully improve your life. And one of the things we'll talk about today is a relationship that people are beginning to understand more about the healthiness of our mouth and the relation of healthiness of our hearts, and seeing that this month of February is American Heart Association Recognition Month. I thought it was pretty appropriate to kind of start our Facebook Live video with that topic. So first of all, I wanted you to know that I feel like I'm extremely interested in education. I've spent the last 25 years in Bloomington really running dental education study clubs and a lot of variety of leadership roles, really to hopefully increase the education in Bloomington and really the knowledge of dentistry. There's so many cool things in dentistry that people can be offered that I'm excited. I've always liked being a dentist, and I think there are so many good dentists in this town and in this South Central Indiana that what I wanted to do, I wanted to be maybe the source for people who wanted to come in and ask questions or send me questions and allow me to answer your dental concerns really honestly, ethically, give you some good advice, and try to give people the opportunity to have somebody that they can bounce their dental concerns about that hopefully you feel would be trusting and trustworthy, and give you the opportunity to have some really good knowledge so that you can then make some decisions about your dental health. So really, I wanted to kind of offer that. And so I think what I'm going to try to do in these videos is I'm going to try to come up with a topic that I feel would be really interesting and kind of health-oriented, I would hope. One that would give you the opportunity to improve the health of your mouth and hopefully improve the health of the rest of your body. Hey, Derek, my nephew just joined, so I'm happy to see him. Anyway, so I would love to create this format where you all would send me questions if you wish. I don't know if I'll be able to answer them as we're doing this live, but I'll tell you what I will do is when we do subsequent meetings, I will have accumulated everybody's questions, and I'll address them at our subsequent videos. And I think that would probably give everybody the opportunity and give me the opportunity to really make sure that I answer your concerns and I give you accurate information. Because here's the concern I have, is when a lot of my patients tell me that they read this on the internet, they read this on any kind of form of social media, the concern in dentistry is statistically about 40 to 50% of that information, unfortunately, is not as accurate as it could be. So what I'd like to be able to do is give you a format that you can feel is really good information that you can then go back to your dentist and share that knowledge or see what your dentist thinks about that. So I would love to be able to be that source for everybody. So I'm excited to do this. Like I said, I'm kind of stepping out of my box. I love to teach. I've always kind of taken a leadership role in my profession, but this is still kind of a new thing for me. So I want you to know that I feel pretty qualified to answer your questions. I am an IU grad, undergrad. I went to dental school at Baylor, College of Dentistry in Texas. So I spent 4 years in Texas going to dental school, and then I spent another 3 years at University of Kentucky. I know, I do have a Wildcat degree, so I am conflicted, but it's pretty easy for me because I am a Hoosier fan by heart. I played football here as an undergraduate student, and I can never not be a Hoosier fan. So, hey Dave, one of my high school friends just joined in. Glad to see that. So anyway, what I'd like to do really is just kind of touch base a little bit about the relationship between the health of your mouth and the health of your heart. And really what we're learning, and most people have kind of read this now in a lot of newsletters and Time Magazine and Reader's Digest, is becoming a really common subject, because I think people are, we know we're living longer, and what people want to do is they want to live longer, and they want to live longer in a more healthy manner. So one of the things that we have learned, and we continue to learn, is that the concept of inflammation is really important. So when we think about diseases in our body, the more we research a lot of diseases, the more we find out that inflammation is a huge problem. Even some cancer research has indicated that some cancers are inflammatory, they're acidic, and they're also anaerobic. And what anaerobic means is that it kind of is a non-oxygenated environment. So I live in that environment all the time, trying to help our patients in keeping their teeth, because a lot of gum disease is definitely inflammatory. It's definitely anaerobic, meaning the bacteria that unfortunately live around our teeth that cause this terrible disease do live without oxygen. So we'll talk about in the future what kind of ways can we suggest doing things to help you control your gum disease so that you can have a healthier mouth, have a healthier body, and really live longer. Some of the data said that people that floss actually live 3 or 5 years longer than people that don't floss. And mainly it's because of that inflammatory issue. Most people that floss their teeth and have less inflammation, they statistically have less inflammation in their bodies. So a good rule of thumb is if you asked your doctor to the next blood test that you had run, if they did something called a C-reactive protein, there's actually something that a doctor can tell you in your normal blood test that would tell you how much inflammation you have in your body. It's a really important ingredient to understand how healthy you are. So next time you have a checkup, ask your doctor, say, what's my C-reactive protein number? It's called CRP. And it is a real great indicator to tell you how much inflammation is actually circulating around your body. It's really an interesting thing to do. And we'll talk about how we can do things in dentistry to also kind of give you good indications as to how healthy your mouth is, very much like a blood test, but we can do that through your saliva. So we'll talk about that later. So I really just want to touch base on the relationship of how periodontal disease is related to several diseases. Arthritis. A lot of people will say that when they have severe arthritis, when their mouth is more flared up, they're going to notice that their arthritis is more uncomfortable. I had a patient recently where I unfortunately had to remove all of his teeth, and he called me about 2 weeks later and said, my arthritis is like tremendously better since I've had my teeth removed. Now the unfortunate sequela to that is he had to have his teeth removed, but the really interesting thing that I learned and kind of verified is that in some people that severe inflammation is really can be problematic, and it could be medically problematic. So another aspect would be if you have atherosclerosis or hardening of your arteries, if you have somebody that has had a stroke, if you have any family members yourself who've had these types of health issues, it's really important that you talk to your dentist about making sure your mouth is healthy. And here's the best thing that your dentist can do for you, or your hygienist can do. They should pick up what's called a periodontal probe, which is a little measuring device that they can place between your gum and your teeth, and they can literally tell you how healthy your mouth is. So unfortunately, not everybody has had that type of examination done, but really you should have it done every year. If you do that, your dentist can really tell you how healthy your mouth is and potentially how healthy you are in general. So make sure you ask them. Ask them about your gum measurements, and they'll tell you that most of them do it once a year, and that's a great way to know how healthy your mouth is and what types of treatment that you can have or should have done in the future. So I really just wanted to kind of touch base today, try to make this a pretty brief video, introduce myself, let you know that what I'm really interested in is kind of being, hey Justy, so my very first assistant when I moved to Bloomington just joined us. It's great to see her. I really would love to be kind of that person that you can use as kind of a information person and someone that you can send me questions about. And if you have any dental questions, fire them off at me. I'd be happy to answer them. If I don't know the exact answer, I'm going to look it up and tell you what I found out and what the research would say about that particular question. I feel like I've studied a lot of aspects of dentistry. I don't know everything. I think anyone that tells you they do know everything or they are really good at everything in dentistry, I'm not too sure I've met that person yet. So I think I'm really good at a lot of things, but I am not great at everything. So if I don't know the answer, I'll either ask some of my friends that do know the answer. I've got a lot of great resources and a lot of really good general dentistry friends that I can bounce questions off of, and I'll share that knowledge with you. So I wanted you to know that, and I really wanted you to know how excited I am to try to, for one, share the wonderful things dentistry has to offer, because dentistry is probably one of the most cost-effective, most beneficial healthcare services that has been in existence. You know that dentistry has controlled their costs about the rate of inflation. So if you look at the last 20 years of dental costs, people talk about dentistry being expensive, but if you really look at how we've controlled costs in dentistry, dentists have done phenomenal jobs of controlling their costs. They are avid business people and want to run their business like a business. So dentistry has not seen astronomical increases in costs like pharmaceutical costs and medical costs and hospital costs. We've just been really good at it. We should be proud about that. Historically, dentists are just not, hey Tim, is that Ronnie? Hey Ronnie. I'm proud of that, and I think that we as dentists, we're not very good at bragging about it, and we should, and we should be really proud of the fact that we deliver great care for people, and the things that we can do for people to keep their teeth literally for the rest of their life is amazing. So we're going to talk about that. We're going to talk about the kinds of things that dentistry can offer you, and I'll help you answer any question you have. And again, if I don't know the answer, I'll find out the next week and I'll give it to you. So next week, what we're going to do is we're going to talk about this little wonder thing, right? Our toothbrush. So we're going to talk about how important this brush can be to making you healthy, but also the importance of what happens if you don't keep tabs of your toothbrush and keep it clean, and how often should you change your brush, and how should you brush your teeth. And it may be silly, but I'm going to probably give a little demonstration on how to properly brush your teeth. So until next time, I really appreciate you watching and commenting, and it's great to see old friends and new friends joining in. And I hope next week you'll join me and we'll talk about the important concept of how to care for your toothbrush so they can care for you. And I'll talk to you next time. See you, everybody.